Hey there, good Saturday morning, guys. It is March 14th. We have Ciara running the computer today. She's just learning it, so have a little patience with us if there are any little technical glitches. But we've got Chloe over here coaching her, so we're all good. She's going to be looking for your comments and questions as we run through some of the headlines this morning. And, you know, they're all related to coronavirus because that is something that everybody is really talking about. The message I want to start off with is one that city and county leaders shared yesterday, and that's that you should live your life. Just be cautious. Be thinking about this stuff as you're headed out. So a couple of the big headlines overnight: the U.S. House passed an aid package related to coronavirus that opens up free testing, paid sick leave, family leave as well. It's expected to head to the Senate on Monday. A lot of senators, though, are pushing to go back in session now to get this vote done. But as it stands, the Senate isn't reconvening until Monday. President Trump says he will sign it into law, but just yesterday, he declared a national emergency, and that freed up a lot of federal money to help fight the virus as well. We had city leaders coming out yesterday, Mayor Sylvester Turner saying that he wants to try to bring drive-through testing to Houston, maybe as early as next week. San Antonio is already doing it. Other cities too, Denver, spots in Delaware are trying this out. It's a way to kind of keep you separated. And social distance is something you're going to be hearing a lot about. I know we just published an article a few minutes ago on khou.com/coronavirus, comprehensive section of our website that is dedicated to coverage of this virus. And you can find the link there to kind of see what social distancing means, since that's a term you're going to be hearing an awful lot. As a result of these new kind of restrictions, you're seeing a lot of cancellations and closures. The Houston Zoo just came out that it's going to shut down until April 3rd. We know the gentleman in Montgomery County who is the first presumptive positive case up there. We know he's in critical condition. That was the latest update we got up there. 4 new cases in the Houston area as well. All of those totals, if you want to dig more into them, they're on khou.com/coronavirus. We're keeping daily blogs updating as new information comes in. So we have a local one that's really focused on the Houston area with some national details thrown in, and then our corporate team is also keeping a national blog going as well. So the main question that we've been getting from people is why is everything being canceled when you deal with flu season, allergy season, the common cold? You have rounds of people getting sick, and now with coronavirus, when we're talking about this, the rodeo being canceled, South by Southwest, Fiesta in San Antonio being postponed. The reason is because the healthcare network would be overwhelmed if everyone got sick at once. So instead of having this spike like this, the idea is to do something called flattening the curve. And this story from Janelle Bluda explains what that is a little bit better.
In recent days, people have been talking about flattening the curve when it comes to fighting coronavirus, but what does that mean? Let's connect the dots. A disease specialist at Harvard estimates up to 60% of people could contract coronavirus. And while public officials are working to slow the spread of the virus, stopping it completely might be impossible. Yet slowing the speed of the outbreak could be vital to saving lives. It's called flattening the curve. The curve is a huge spike in cases that could overwhelm the American health system. Hospitals right now are already dealing with a bad flu season. If they are inundated with coronavirus patients, there may not be enough beds or critical equipment like ventilators available. That's why public health officials want to cancel mass gatherings, encourage people to work from home, and practice social distances. Those tactics may not stop the spread, but it could flatten the curve. Connecting the dots, I'm Janelle Bluda for H-Town Rush.
All right, so hopefully that explained it a little bit more. We do have an article on khou.com/coronavirus as well that outlines that in a little more detail. Another article I want to push you to, and this one is wildly popular because I think so many people have this question. So pollen levels are out of control right now. You're seeing a lot of people sneezing and coughing. And in this atmosphere where we're all kind of like, you want to be on the lookout, right? Because we know coronavirus is spread through droplets. Here's what you need to know when it comes to the differences between allergies, the flu, and the coronavirus. So you kind of know what to look out for. So with allergies, you're talking about itchy nose, itchy eyes, roof of the mouth, runny nose like I have right now, sneezing, maybe watery red or swollen eyes. Because pollen levels are so high, we're going to check in with Cheetah for a minute and she'll tell you just how high. You're going to be seeing a lot of that. So how that differs from coronavirus. Coronavirus symptoms include a fever. That's not what you're going to see usually during if you have allergies. A cough, shortness of breath or difficulty breathing, and those symptoms start to appear, we've told you over and over again, between 2 and 14 days after exposure. That's why there's that 14-day kind of self-quarantine if you think you've been exposed. The flu, the fever over 100 degrees, chills and sweats, congestion, sore throat, and that's really the sticking point here. The flu, you'll generally get a sore throat, and that's different from the coronavirus. Muscle aches, fatigue, weakness. Much more comprehensive article in the link up above. I know a lot of you are sharing this information because it is so important. And I promised we were going to check in with Cheetah for a look at how high the pollen levels are. Here you go.
Well, we are really talking about heavy pollen right now. So if you are outside, you'll probably see some of that yellow either outside of your home, maybe on your street. And that's mainly due to the oak trees. So that live oak, it is really heavy. So we started the week off and it was about 700 parts per cubic meter. They survey usually just before our lunchtime hour every 24 hours. So this is the update here, and take a look, over 3,000 parts per cubic meter, extreme levels as far as our tree pollen goes, and mainly if you separate that with the oak category. So if you see those big oak trees, maybe you have them in your neighborhood, you know, honestly, I don't know if right now is the time to maybe take the walk around the neighborhood, maybe try to do something indoors. Grass and your ragweed at moderate levels, but it is mainly due to that tree pollen. Now, air quality. Early Saturday, air quality is good. As we continue for your afternoon, it may drop down to moderate levels. We'll continue to monitor that for you as well. But temperatures overall, in general, over the next 7 to 10 days, we really don't see a whole lot of variation with this forecast. We stay pretty steady. 80 degrees this afternoon, low 80s tomorrow, and that takes you in through next week. 20% chance for a shower this afternoon. It should be extremely limited, producing maybe a trace to a few hundredths of an inch, and that should be about it. The southerly winds will hopefully keep the fog in the morning pretty light to patchy at most. Otherwise, it's just clouds, temperatures in the 70s and 80s. And again, we're going to continue to monitor that pollen for you.
All right, can you believe spring's almost here? Feels like it is outside most days, but I want to go back through and answer a couple of questions and respond to some comments that we've seen in the comment thread here, because some of you make really good points. So Joe reminds people you don't need to be panic buying. That is something we've heard from stores. We've heard it from city and county leaders. The CDC even says, unless you're caring for an elderly person, an elderly relative, you don't need to worry about stockpiling. This isn't like severe weather or a hurricane approaching. We're not going to lose power. We're not going to lose water service. Stores aren't going to shut down. Now, some have altered hours. HEB, in an effort to give employees time to restock, is changing its hours to 8 a.m. to 8 p.m. But it's still going to be open during those hours. I've heard from some 24-hour Walmarts also that they're closing for a period just to give their staff time to restock, but they say they are restocking. You don't have to worry about anything running out. Also, I want to hit this again. I know I've said it almost every day in these updates. Y'all don't need to be buying all the toilet paper. Remember all those symptoms I just went down for the coronavirus? Nothing on that list suggests that you're going to need 7 24-packs. So leave some for everyone else. Same with bottled water. And I know a lot of you have that common sense. You're thinking about things, because when you buy up all that stuff, you're taking it from your neighbor. who might actually need it. So just think about that as you head out today. I know my boyfriend just texted me saying he was going to go to the grocery store, and I'm like, Justin, no, why? He needs coffee filters. We bought coffee 2 nights ago. Now we're out of coffee filters. Priorities, though. Need the caffeine to keep going. I just want to scroll through and see if there are any other comments. Monica says, yep, I'm taking my allergy meds not to freak anybody out. And you know, there's sneezing in our newsroom, to be sure. Everybody kind of does that look. Sneezing isn't going to be a symptom of coronavirus, though. However, you do want to be conscious of it because, like I mentioned, it's spread through droplets. Coughing, sneezing, that's the easiest way for it to be transmitted. Felda says she's already sick of hearing about coronavirus. And she points out washing your hands. Good personal hygiene is still the #1 way to prevent the spread of coronavirus. I want to mention too, there's a Houston company that's working on a vaccine. There are actually several Texas companies, but Graphics in Houston says it has a vaccine candidate. That's positive progress. The thing is, it still has to go through FDA testing, and that can take a while. It also takes a whole lot of money. So this aid package that came through the House might be able to help with that. The company still says it takes a while for that to trickle down to the private companies who are doing the development. But that being said, there isn't a vaccine out there. So if you're seeing something on social media that says this is the cure, this is the fix, this is the treatment, doctors and the FDA say, it's a scam, don't trust it. Please keep that in mind as well. When you're looking at information and sharing it on social media, use that critical thinking. Try to find the source of it. Someone sharing that a friend of a friend of a friend is a nurse somewhere who says this. Try to find information that backs it up before you share that, and more eyes see that. Going through.
Someone asked, can you explain social distancing again? What is that?
So social distancing is the idea that you want to keep about 6 feet between yourself and other people to stop the droplets from going around. You don't want to gather in big crowds. That's why a lot of these events are being canceled. You think about anything that's going to put you and a bunch of other people in tight quarters, probably not the best idea. You don't know who's practicing that good social or the good personal hygiene. I will say I'm real proud because in the past couple of days, anytime I've made a trip to the bathroom and there's someone else in there, I have heard them washing their hands, and I'm horrified to say that has not always been the case. But it seems like that messaging is getting through. You want to wash your hands for about 20 seconds. We've shared a bunch of different song lyrics you can sing to. I posted the photo in the comments of one of our updates a couple days ago. Maybe I can dig that back up. But like the chorus from Backstreet Boys, I Want It That Way, it's 20 seconds. The alphabet song, 20 seconds. Happy Birthday Twice, 20 seconds. Just keep on, that's the time you're supposed to be scrubbing. And I want to mention this because maybe you guys have been super vigilant like I've been and your hands are really dry now because you're washing them so much. We talked to a doctor yesterday who said it's super important to keep your hands moisturized because if they start cracking, then you're even more susceptible to any virus, not just the coronavirus, but you're creating new ports of entry essentially for germs into your body. So keep your hands washed and then keep them moisturized. Oh, Jackie, when I made the comment about 7 24 packs of toilet paper, Jackie says some people have, houses full of teenage boys. Or, I get it, your kids are home, you maybe need a little bit. But understand, there was a rumor going around that all of our toilet paper comes from China. It's not true. It's made here in the US. They're cranking it out. So it's gonna be restocked. So if you need to buy a pack today, cool. You're not gonna need to stock up for the next several weeks. Megan asked when HEB changes the store times. It starts today. Starting now, and it's temporary. So once I think the panic buying settles down, we'll probably see that change, but we don't have a set end date for that. Sorry, I'm looking through. Ooh, a lot of people are saying that they can't find soap. It is antibacterial, anything, soap, antibacterial wipes. That stuff got cleaned off the counters, pun not intended. But this gal just pointed out, oh, where'd it go? Rachel says, try the corner stores. Corner stores, dollar stores might have more in stock because they're not what people typically think of. I was out of shampoo yesterday, thought I would go to the Target that's over here near the station. The entire parking lot was full, which it never is. So I decided, you know what, I'll go to Ulta because people aren't gonna make a run on that. I know I can get my shampoo there. So maybe look at some different alternatives. It may include making multiple stops, and that kind of defeats the whole thing about social distancing. But just be cautious when you're out there doing it. And I want to say, because I've heard multiple stories, be kind to the poor people who are working in the grocery stores. It is not their fault. They are working their tails off. And I can't even imagine what the stress and hours are like. So just a good rule of thumb to be kind to everyone. You don't know what their stressors are. If they're dealing with someone who might be sick at home or they're worried about someone. So it's easy to kind of lash out when we're all stressed and anxious. Just deep breath. We're all going, you don't know what anyone else is going through.
Becca Salinas says that Home Depot, Lowe's, and the Office Depots also have like cleaning supplies.
Ciara, do you have a mic on?
Oh no, I don't.
Okay, so repeat that loud.
So Becca Salinas says that Home Depot, Lowe's, and Office Depots and Office Maxes have cleaning supplies as well.
That's a perfect alternative. I mean, if you need groceries, obviously you're going to have to go to the grocery store. But when you're thinking about some of those other things, they're carried in other stores that might not be your go-to initially. Valerie asks if we've been sharing, it just popped out. Sorry, the feed, once it gets to a certain point, erases the previous comments, but she was asking about the presumptive positive case in Montgomery County, that gentleman who we now know is in critical condition. And one of the reasons city leaders said they decided to cancel rodeo is when they found out that he had been there. And his case was not travel related, so it was an example proof of community spread. What we know is that investigators are kind of frustrated. They haven't been able to get information from him about which tent he was at or where he was at cook-off. And that's something people really want to know. We do too. We are eager to get that answer as our investigators. We don't have it yet. When we do, we will definitely share that information because cook-off is such a hugely popular event. Lots of people were there on that Friday night when he was also there, and they want to know, kind of, were they in proximity? I would encourage you to download the KHOU 11 mobile app. You can set up notifications, and we will send you new information as it comes out. And again, we are updating these daily blogs. If you go to khou.com/coronavirus, the first story up there is always our daily blog, and you can scroll back through. Our web team, Ciara, Chloe, everybody else who works on khou.com is just tracking these updates so that you can get as much information or as little as you want, because I understand some of this stuff is super overwhelming, and getting those constant tallies of numbers, you know, if you're already worried about things, that just adds to it. So we don't want to force that on you, to be sure, but know that there's that resource. When you want to dig into it, it is there. Bay Win just asked, why are people going crazy for toilet paper? So I asked our mental health and wellness expert, licensed professional counselor, Bill Prasad, that yesterday. It's psychology. So with coronavirus, there's been fear, there's been confusion, and the natural human reaction is, well, I need to do something. And sometimes that thing doesn't make sense. Sometimes it's going out and buying out the shelf of toilet paper. And sometimes it's copycat. You see someone else buy a couple and you're thinking, oh, maybe they know something I don't. I'm going to get some, and it just escalates. Everyone's doing the same thing. That's the explanation there. Sorry, scrolling through. Amir asked, are we really going to shut down for a few weeks? This is a big rumor that's been going around. There was no lockdown. Lena Hidalgo, a couple days ago, what was it, Wednesday, even said it'd be impossible for Houston to close its borders because it doesn't have any. It's different when you think about countries like Italy and now Spain just announced it's going on lockdown. When you're a country, different process, right? So any decision like that would have to happen at the federal level, and that is not something that's happened yet. So please keep that in mind. If and when it does happen, you will see major national headlines about it. Don't trust the stuff that you're just seeing on social media from random people. Go to the news sources that you trust. We here at KHOU will share that with you. Of course, we're an affiliate of CBS. CBS would share that information with you as well. Nina must be someone who works at one of these stores, because she said we're working more than 8 hours trying to make sure the aisles are stocked. We appreciate everything y'all are doing. Everyone in the medical field right now who is stepping up in a huge way, just thank you. That's all you can say, really. We appreciate you very much. Scrolling through. Jamie's frustrated that they're shutting everything down. The rodeo, Six Flags, says, don't they know the kids are on spring break? Well, a lot of districts are canceling school too. So even districts that weren't on spring break, they certainly are now. And having the conversation with your kids about that can be tough, especially depending on their age. I want to direct you to the Facebook Live we did yesterday with Dr. Alvarez and then Bill Prasad, our KHU 11 mental health and wellness expert, about this, because you don't want to scare your kids. You don't want to stress them out unnecessarily. So Bill suggested, in the case of kids, really emphasizing the washing the hands thing, make it a game, singing through the alphabet or the happy birthday song, finding activities for them to do in the house. I know that's hard. And then teenagers, because this was of interest to me because I have an almost 13-year-old and a 14-year-old. And my 14-year-old was really upset when school got canceled. Really upset, like 40 minutes sobbing, because she had a band festival coming up in a couple weeks and it looked like that was going to be canceled. And in a teenager's mind, right, the world kind of revolves around them. And so what Bill suggested is validating those feelings. You know, I understand why you're upset. That is frustrating, but helping them look at the bigger picture too. Why school is shut down and why it's important. And I pointed out that her band teacher has a baby. And so if he were to get exposed, there's the potential that the baby could be exposed. And I will mention this though, children and babies seem to have mild symptoms with the coronavirus. It's older populations that seem to be hit hardest, and 80% of cases are mild. That's good, but it's also dangerous because you might not necessarily know you have it or try to push through it, and that makes you a carrier. You're exposing other people. It's that 20% that need to be hospitalized, go into ICU, and the small percentage that pass away due to complications from the coronavirus. Tina, thank you. Tina said something very kind. Yes. So Shell just said, please mention that people need to be considerate of babies and elderly. She's talking about when you're buying these things. So don't go to the store and load up on baby formula, baby foods, Ensure, stuff like that, stuff that the more at-risk populations need. Megan said they're talking about the case in Montgomery County. The gentleman who was the first to be a presumptive positive up there, the man who is in critical condition, is in his 40s. And again, we don't know a lot of details. There are a lot of social media rumors. It's nothing that we can confirm because we haven't heard it from the proper channels. And we want to be really careful about sharing that information with you. We would rather be right than first. We want you to get correct information and not something that is sensationalized or just intended to scare. One of the mantras we have here at KHOU is facts, not fear. And admittedly, sometimes those facts can be scary, but we don't want to share them with you in a way that's intended to incite fear. And we do also want to offer perspective. So that's why we're having these conversations. Oh, Treasure asks, if you go to the ER, do you need to call first? Yes. If you have some of those symptoms that we listed for coronavirus, we're talking about a cough, fever, trouble breathing, call your doctor first. Because the challenge is if then you walk into the doctor's office or the ER or the intensive care, or I'm sorry, the urgent care, anyone else who's in that area has the potential to be exposed. So definitely call. We get a lot of questions about testing, where you can go to be tested. That's something you need to talk to your doctor about because some doctors' clinics can do that. Others don't have the ability and they're going to send you somewhere else. But it's a conversation you have to have with your doctor. Unless we open up these drive-through testing sites, which could happen next week. There's no definitive date on that. But Mayor Turner said the goal was next week. Then that's something that the public could just go to. I want to address this because I think it's important and it's something I've definitely seen a lot and it just disappeared. But Tammy basically said the media spurred this. And again, we're trying to share facts with you, not incite fear. And I think media is such a broad term. I think in large part social media is to blame for this because people are sharing a lot of stuff that just isn't true. And this is really the first time we've had an outbreak where social media was in play. The last time we had something near this scale was H1N1. That was in 2009. Facebook was just getting going. Twitter wasn't even a thing. Instagram certainly wasn't. And so there wasn't this way for people to share information, good or bad, with people. And everything, I mean, you're probably going to agree, right? Like everything is escalated because of social media. Think about the dialogue over politics. Escalated because of social media. Response to something like this. It's celebrity news. All of that stuff has gone way off the charts compared to back like pre-2010. So that's some perspective. I think you'll find if you go through our coverage here at KHOU, we've really tried to be thoughtful about what we share and how we share it. And there was a big discussion we had yesterday as well, because the goal isn't to get you panicked. I'll start with this. I'll repeat the message I started off with, which is what we heard from Judge Hidalgo yesterday. Live your life, but just be cautious. We don't want you to not be prepared or not understand what's going on. The same way, when we see something spin up in the Gulf. If it has the potential to head to Houston, we're going to share that with you. We're going to share what you can do to be prepared. We're going to share what you can do to prevent damage, if that's a possibility. And I know it's frustrating. There's a lot to take in, and it can be scary. It can be. I'm going to be real with you. It's overwhelming working in the newsroom and seeing these updates constantly come in, and then, being out in it. But if you're cautious, just keep washing your hands, be kind, take care of the people around you. It's all you can do right now. You want to come on over?
Sure.
Ask
I better
Chloe
comb my hair.
to have Chloe grab you a mic.
I was just gonna let people know.
Come on over.
Okay. Howdy,
Reporter
friends.
Chris Costa.
How are you? Don't you just squat down?
Here. Chloe's
Yeah,
got
I'm
you.
sitting.
Chloe refuses
Like
to come.
magic off screen.
It'll take a sec for them
Yeah, sure.
to get it on.
Turn the mic on.
Let's see, what am I doing here? You
There you
guys
go.
liking all my double chins as I look down my? There we go.
That's always a good angle.
Yeah.
Oh, here. That's gonna.
Yeah, it's gonna
Yeah.
get in the way. Okay, friends. Hey, I am going to talk to the Houston Health Department's
I'll
call
Chloe
center.
bring you over.
Oh, okay.
Oh, okay.
Look at that.
I was gonna grab the phone, but
Don't worry about it. Self-sufficient.
Okay.
Hey, so I'm going over to the Houston Health Department's call center. Like they have the they have like an Ask a Nurse line kind of thing. So if you guys have questions that you want me to ask them, I'm going to be asking them, hey, what are the top 3 questions you get about coronavirus or COVID-19 from people calling in and asking you? So maybe it's about testing, maybe it's about symptoms, maybe it's about something unrelated. If you guys have questions, what would be the best way to get them to me? Email?
Email, yeah.
Yeah?
Probably directly to you.
Yeah.
Okay,
Because I'm going to
so-
go over there today in about, 15 minutes or so. If you guys want to send some questions, I can ask the nurses for you.
Sierra, do you want to throw his email up there?
Twitter, would you prefer that?
Oh, Twitter's good.
Yeah.
Not everyone has Twitter, though.
Oh, that's true.
We do. There's a lot of news folks on Twitter, but Facebook is what we see a lot of. But
Okay.
email, everybody can email.
Well, you guys are on Facebook right now. If you put in the search bar Chris Costa TV, so it's COSTA and then TV like television, you can message me on there.
Awesome.
Cool. Bye, guys. Have a
Thank
good
you,
day.
Chris.
So you're working on your title and you just leave.
Sorry.
But this is what's awesome. We are trying to answer your questions. We also have another really amazing tool called ZipWhip. If you want Chris to ask your question when he's over there, find him on social media and send that to him. If there are other questions that you think we might be able to get the answer to, you can text us, which is a pretty cool tool. The number is I'm going to repeat this a couple of times, and we'll share it in the comments as well. It's 713-526-1111. 713-526-1111. And it's a great resource. You can text us questions. You can text photos and videos, anything like that, comments on a story. You can also use keywords, and we will automatically send you information. So if you text facts, just the word, no hashtag or anything like that, just the word facts to 713-526-1111, we'll send you the latest information that we have on coronavirus. If you want the forecast, you can text weather, traffic, text traffic. All of that stuff is auto-generated, but for specific questions, our staff is trying to go through and answer those as best we can. Okay. Going back through trying to find more questions. Judy says, I care for my 96-year-old mom who is bedbound with dementia. Any extra precautions I should take with her? Really just limiting visitors and practicing good personal hygiene yourself, I think, is the best course of action, because that's what's doing the transmission right now is that person-to-person contact because of droplets that we're accidentally spitting or coughing or sneezing. Sabrina says, what do we do if we don't have a family doctor? I'd call your insurance and see what the best course of action is there. And yeah, depending on your company, you might have to wait until Monday. So that's, I know you'll have to sit on that for a day or so, but probably the best there.
What was that number again?
713-526-1111.
Any other text virus, right?
Fax.
Text fax.
I think there are a couple different keywords, but
Fax
I've
is
seen
one.
fax one, yeah. Tiffany asked, should you take the test if you don't have symptoms? No. If you think you may have been exposed, they ask you to self-monitor. So basically, like, try to keep a low profile and wait to see if you develop symptoms, which is generally 2 to 14 days after exposure. But you don't need the test if you're not suffering a fever, cough, and shortness of breath. Trying to see if there's there's a lot of questions on here. That's why I'm scrolling through so much. Jackie points out that yesterday the governor said Texas could test 237 per day. I think Harris County came out and said 600. I need to double check that. Hold on. I have that information. As you can tell, this is not scripted, so I'm kind of rolling with how many tests Harris County can do now. I know it was double from when they started testing on March 4th, but I don't know where I saw that number. Ciara's working on that. We will find that. We will find that for you. Narita says, what scares the public is when our leaders get on TV and declare a state of emergency. I get it. President Trump declared an emergency yesterday. We have one here in Harris County, in Fort Bend County, in Houston proper. That's a lot because the word emergency is in the title. I get it. But the idea is to make sure there are the resources needed to respond. So that's what those declarations are really doing. It's making sure that there are funds allocated to respond. It's to getting more tests available, get more treatment. Part of the issue is there isn't really treatment of the coronavirus. Doctors can treat symptoms of, but there's nothing for COVID-19 itself because it is so new.
It is 600 people.
600 people a day? Or 600 people, that's how many it's tested?
It's saying that all it's saying is that they're now able to test 600 people.
Okay, but so in Harris County?
In Harris County.
In
Well,
Harris
City of
County?
Houston.
City of Houston, it's 600.
Yes.
Perfect. Ciara, thank you.
No problem.
She dug that up on khou.com. I will say, sometimes our search function is a little wonky. So a lot of times I'll just go to Google and I'll type in KHOU and my question or a couple keywords, and it'll bring up our articles because we have done so much because this is a matter of national importance. Jackie responded to Narita and said exactly, yeah, states of emergency allow for immediate funding. Jocelyn asked, how long does the virus live on money? So we brought on a public health expert. This was last week. She said the virus only lives for a couple hours on inanimate objects. It needs humans to survive longer, if that helps, but it is still a couple hours. And a lot of places have gone cash free. That's something else to think about. Hazel says, I live in Montgomery County. I have lung disease. I hope an antibiotic will help if I catch this. That's the challenge, is there isn't really treatment. So that is even more incentive for you to really steer clear of crowds, limit exposure to other people, wash your hands, disinfect. So important. Todd, thank you. He says, if something sounds extreme or doesn't make sense, like locking down the city, it's probably, he uses a word I won't, but it's probably not true. And I know most of you out there are using that critical thinking, but I also understand that when there's all this information flow, because it's just constant updates, that it can be easy to think like, oh yeah, I guess that's the next thing that's happening, but just make sure to verify it. Look for a couple different sources. That's what we do, or go directly to the source. If the city of Houston is gonna lock down, which is not happening, that would be shared on every social media outlet, and you'd be hearing it from the mayor, not Larry, your friend of a friend of a friend of a friend who shared that on Facebook. You know that. Maria asked, what's the update on the vaccine? What we know is multiple companies within Texas, nationally, but here in Texas, multiple companies are working on a vaccine, and Graphics, which is a Houston company, says it has a vaccine candidate. The issue is the timeline that it takes for vaccines to be tested. They have to go through 3 phases with the FDA to make sure it's safe. They don't want this concoction to create more problems for patients. So it goes through 3 phases of FDA testing, and that costs money. So these emergency declarations open up the funding, but Graphics' CEO says it takes time for that money to trickle down to these private companies. So you're looking at anywhere from probably a year to 3. This is a matter of national importance. There's a lot of focus on finding a vaccine. So chances are that could be bumped up because there's so much pressure and so much effort. But all the leading vaccine experts, and we have a lot of them here in the Med Center, say it's gonna take a while. It's not something that's gonna be immediate. Tina asked about drinking water because it'll push the virus down to your stomach. Look, we've heard that. We have verified that is not true. We have an article. So in addition to khou.com/coronavirus, I'd suggest you go to khou.com/verify. Our Verify team is working on dispelling, or in some cases proving, some of these social media rumors. And that is one that has been debunked by health experts. Another one is that drinking water is going to spread the virus. We have a number of Verify articles on this topic. And I think Ciara is looking for that one right now. She started furiously typing a second ago. Oh, why did this revert? Okay, hold on. I'm scrolling back. Clarissa says, why don't you start spreading the word and start calming the hysteria by sharing what Texas state officials are saying, which is Texans should relax. I feel like that's kind of been the message here. It's actually the exact, well, not the exact wording I started off with, but live your life, but be cautious. We want you to be aware of what's going on. We want you to be aware of the steps you should take and how to keep yourself and your family safe. But there's no need to stockpile anything. I wonder if Clarissa may have joined us late in the conversation, because that is something I have tried to hammer home. You do not need to be doing any panic buying. The CDC recommends stockpiling stuff only, and stockpiling is light, like having a couple weeks supply of items if you're caring for an elderly relative. Otherwise, this isn't like a severe weather event. We're not going to lose power or water service. Stores aren't going to shut down. They have teams restocking the shelves. So, you know, I understand loading up the cart if your kids are home from school this week unplanned, because again, I have an almost 13-year-old and an almost 14-year-old, or an almost 13-year-old and a 14-year-old, and they eat everything. And my almost 13-year-old just texted me that she's not feeling well. So that's definitely not reassuring. But I want to make sure that that message is loud and clear. Live your life. Be cautious. Understand the anxiety some people have about this, but it's not a need to panic or go out and stockpile stuff. I actually have to wrap it up because I am running to an 11:30 appointment. I hope you've gleaned something from this. Ciara is continuing to share some of our links if you want to get more information there. Thank you for being kind to one another. I think that's so important right now. And to also using that critical thinking and sharing information only after you can verify that it's accurate. Because in this age of social media, it's spreading like wildfire. So I am relying on you guys to do some of that. Have a good day.